welcome to our HSCT Warriors Learn with a Warrior webinar. Usually we do these on Wednesdays, but I'm glad to know it's Friday Eve. We're glad to welcome our team from Adia Med in Florida to learn more about expanding access to HSCT. So tonight we're going to be hearing more from Dr. Evan Thomas and Larry Powalitz of Adia Med, and hosted by Jan Marie Morgan and myself. So I'm going to just read this quick bio of Dr. Evans, but while I'm doing that, I would love to invite everyone to answer this quick poll. It's just brief, 3 questions, because we'd love to learn more about our audience and who is attending, especially if there are questions you would like to see answered. And speaking of that, if you do have questions you would like to see answered during the Q&A section at the end of the presentations, we would love for you to share those questions within the Q&A box, if you will, that if you hover towards the bottom of your screen, you should see the ability to click on that Q&A button, and that should open a window where you can type in a question and ask the team or the panel whatever you'd like. So while you're practicing with that and answering the poll, I'd love to introduce Dr. Evan Thomas to you. He completed his medical and engineering education at the University of Alabama, where he earned both an MD and a PhD in biomedical engineering. His training included specialization in treating complex brain and nervous system conditions, refining his expertise in non-invasive radiosurgery techniques. Prior to his medical career, Dr. Thomas obtained a master's degree in nuclear engineering from Berkeley, University of California in Berkeley, and has contributed extensively to the research, authoring over 150 publications. Dr. Thomas is committed to a patient-centered approach, placing high importance on collaboration with patients, their families, and healthcare providers. Dr. Thomas's unique background in both medical science and engineering supports his mission to deliver personalized care tailored to each patient's needs. And I'm so grateful for this opportunity to get to know you better, and learn more about what Larry has going on at Adia Med. So, Larry, with that said, I'm going to turn things over to you, and maybe even stop sharing my screen so that when the time comes, you all are welcome to open yours.
Right. All right. So let me just tell you who I am. I'm now 62 years old, was diagnosed with MS in my late 50s, and it changed my entire life. I was told to take DMTs, Ocrevus to be specific. Said no way. I did looked up information on other methods of repairing MS, and HSCT to me was the best choice. So I went to Mexico, went to Monterey, had the treatment, and I was literally mostly paralyzed on the left-hand side, had brain fog, and was told I'd be in a wheelchair within 3 to 5 years. That was 5.5 years ago. I now have only dropping foot, no brain fog, as you can see. I talk pretty clearly. My left hand is back to normal. I can write checks. I can write a letter. So because I'm so grateful that I don't have, I'm not in a wheelchair, I guess you want to say, that I decided to open a nonprofit and start helping patients get HSCT. The nonprofit did not generate enough money. I only sent 2 people to Mexico with the donations. So I said, that's not enough. I have to do more. Last year, I purchased a publicly traded company, Adia Nutrition Incorporated. That company was purchased to create a clinic in Florida that does HSCT treatments for MS. Since that time, we're actually opening up to do HSCT for multiple types of immune conditions. And we'll let Dr. Evans explain all that. But my goal to finish my life is to help as many patients as possible, and not just with MS, with any other autoimmune condition. We're working on autistic children right now. So there's all kinds of possibilities we can do that are outside the normal pharmaceutical drugs. Um, and I'll tell you a quick story about Dr. Thomas and I. He's actually The entire floor beneath my clinic is his clinic. He also has space beside my clinic on my floor. Um, we had a squatter that was in my side and was living there. And then I found that he was going back and forth between my unit and his unit. And I just happened to bump into him in his unit and said, "Hey, so you know, there's been a squatter coming on both of our sides. You might want to make sure somebody's watching your side." And kind of the humor of how we met is by a squatter. After that, one of the doctors, another oncologist, came in for treatment in my clinic. And I said, "I really need to talk to Dr. Thomas. I love that he's in the same building. This guy has a great background. How do we meet?" She makes a phone call, has him come upstairs. So from that point on, we went to dinner, talked about what we do. We both have the passion to help people. He has a lot of different new radiation treatments he does, like the joint glow concept, a lot of things that are new to the United States. So in my opinion, the best choice we could possibly have as a medical director for Adia Med. So with me saying that, let's go ahead and let Dr. Thomas take over and explain what it is we'll now be doing at Adia Med in Winter Park, Florida.
Well, thank you for that that wonderful, warm introduction, Larry. And again, the choice anecdote of how we met over a shared squatter within within our mutual shared space. Let me see if I can get my presentation shared. Um, Jan and Jen, how am I doing? Are we seeing my slides? All right, we're on top. So, what I want to say first is how much of an honor or privilege it is to be talking in a new area of scientific space for me. Jen mentioned the so-called concept of learning with a warrior. And, I want to tell everyone here that's listening that that's what I've been doing with Larry, learning with a warrior. So my background is, I'm an oncologist by training, but a radiation oncologist specifically. And so, although we have exposure to stem cell therapies in training, and we often sometimes use radiotherapy in certain forms and formats to help condition people for certain types of stem cell treatments, it was never really something that garnered my interest until I'd met Larry. And I got to see firsthand the impact that it had on his life and his particular neurological condition, multiple sclerosis, which is what really catalyzed my interest, which is using alternative treatments for hopeless neurological diseases people are suffering from, been on various medical regimens their entire lives and castigated to wheelchairs or hospice, where there's nothing else left to do. And so the exposure to stem cell therapy for these type of conditions, among others, has really opened up a new chapter in my career that I'm very excited to explore with Larry and hopefully the rest of you that are listening to this. So with that, a segue into my talk, and which is about expanding access to hematopoietic stem cell therapy for autoimmune diseases. My background, as Jen mentioned, I have an MD and a PhD in engineering, and I practice oncology here in Winter Park. I serve as the founder of the Renaissance Institute and also the medical director under Larry for Adia Med. So jumping in for those of you who are new to the conversation or maybe need a little bit of a refresher, what are stem cells? What are they? Why are they useful to us? Why are we here talking about them? So, stem cells, briefly, are undifferentiated cells that are cells that can become many other things than what they are, with the ability to either self-renew or self-perpetuate and turn into other cell types. Why are these useful to us? Well, it turns out whatever age we are, stem cells play a very important key role in not just tissue development, but also maintenance and repair of our existing other cell types, regardless of what age we are. In medicine, stem cell therapy, we aim to harness the properties of these cells for tissue regeneration, modulation of overactive immune system, or modification of disease types like MS or other autoimmune diseases. There are a number of different types of stem cells, and for those of you wading into the stem cell landscape, these can be very confusing because you may have heard in the news some stem cells are politically contentious, some stem cells are okay, some stem cells are allowed in some states, but not federally, and so forth. So why all this? Well, it's because there are different categories and types. Embryonic stem cells are stem cells that are what they sound. They come from embryos. These are the cells that can become literally any other stem cell type, any other cell type in your body. They're so-called pluripotent, which means they can do anything. These are the stem cells that can be politically contentious. Some of you may have followed the news from even as far back as 20 years ago, Supreme Court cases about this. Um, we are not allowed to do research with stem cells that come from discarded human embryos. And this has been a political hot button issue, but scientists have worked ways around it, and we actually now have ways to turn other cells into these so-called pluripotent stem cells. So even though there are hot button issues, we are now able to medically and scientifically work around these issues. Okay, other stem cell types, adult stem cells. These are the stem cells that all of us on this call have. Myself have, Larry has, Jen has, those of you listening to the call. These are stem cells that are found in certain reservoirs within our body, within our bone marrow, within our nervous tissue, within our GI system. These are stem cells that serve as the reserves when our other cell types are injured or depleted. These cells serve to help replete those other cell types. Induced pluripotent stem cells. These are cells that I was referencing before. We can take a cell type like a skin cell and we can do certain things to it. We can induce it to become a pluripotent stem cell that can become other things. So lots of different stem cell types. How do we turn this into what's relevant to you, a treatment for a condition that people have? So again, this goes back to what all these cell types are and where we can get them to do. So when we are talking about an autoimmune condition, for example, we don't need necessarily a stem cell that can become a brain cell or a foot cell. What we need are cells that can replace the immune cells that are causing a problem. And so in this situation, we're looking at hematopoietic stem cells. These are stem cells that are found in our bone marrow, our peripheral blood, umbilical cord blood. And these are cells that can reconstitute the problematic cells that drive autoimmune disease. So when we look at these stem cells, how can we use them? Turns out there are dozens, hundreds, even thousands of diseases that can potentially be impacted by stem cell therapy. Looking at the stem cells we want to talk about today, which are HSCTs or hematopoietic stem cells. I mean, just looking at these, the top of the list we have here that has the most evidence behind it, and what Larry mentioned to you has been impactful for his life, are multiple sclerosis. The same approach can be used in a lot of other autoimmune conditions, systemic sclerosis, lupus, and even diseases we don't typically think about as autoimmune diseases, ALS, Parkinson's, Alzheimer's, also are diseases with inflammatory components and diseases in which we're exploring the use of these stem cell therapies. So, what is HSCT or autologous hematopoietic stem cell therapy? So, in this procedure, what we are doing is we're taking a patient's own adult existing stem cells, and we are inducing a process that causes those to be released into the bloodstream. And then we have a process by which we can collect or harvest those. We take those out, we can store them, we can bank them, we can automatically infuse them. In some situations, we can even do some engineering on those cell types, but we take them out so we can use them for another purpose. In a patient with an autoimmune disease, like multiple sclerosis or lupus or systemic sclerosis, where their own immune cells are attacking their body uh, inappropriately, we can bank those stem cells. And then what we do is we come back and we can administer certain drugs, chemotherapy, immunotherapy, certain antibody drug conjugates, which can wipe out those problematic immune cells. And then we put the patient's own autologous hematopoietic stem cells back in them and let them reconstitute or regenerate the immune system. And so, in this way, we can give the immune system a fresh start, a fresh look at the body, so that hopefully we're giving that person an ability to have an immune system that's not attacking its own healthy cells. So, again, what are indications where this has been studied and explored? What I'm showing you here is a table from the Journal of the American Medical Association, which is just a snapshot of some of the clinical trials where people have looked at using autologous hematopoietic stem cells to modulate autoimmune disease. And what you'll see here is that MS is the big one, and that's what we're going to spend a lot of time talking about today. But again, other diseases like systemic sclerosis, Crohn's disease, other immune diseases are also targets for this. And if you look at the table on the right and you look over into the primary outcome, what you'll see is really promising numbers 70, 80, 85, 90% activity or disease-free for survival at 5 years from some of these autoimmune conditions that were once considered death sentences for people. So, as I've come to learn very recently, and I'm very excited to appreciate and integrate in my own practice, this is truly a paradigm shift in how we approach and modulate and think about autoimmune diseases. So let's dive into multiple sclerosis a little bit more. What is happening in a disease like multiple sclerosis? So, what happens is all of our bodies have immune cells. We broadly classify them as white blood cells, but that's just a name because of how they look under a microscope. Beyond how they look under a microscope, they have different characteristics, and we divide them into types based on those characteristics, whether they're T cells or B cells or macrophages or neutrophils. There are a whole array of cells in the immune system that do different things and have different functions. Some of these white blood cells are pro-inflammatory, some of them are anti-inflammatory, some of them have housekeeping duties. And so it's my job as a physician to know all these different types and how we approach and modulate and recognize which types are the problems and which types can be reorganized into helpers. In multiple sclerosis, what happens is your T cells that are trained to normally recognize problematic infections or infiltrations or even early cancer cells get confused. And they're looking for markers of things on cells that don't belong so they can tell your other immune system to attack. But what happens in multiple sclerosis is they start looking at the tissue that wraps around your nerves, a tissue we call myelin, and they inadvertently get confused that that myelin doesn't belong there. And so they start depositing signaling molecules on the myelin and designate it for attack by your other immune system. So this is almost like for those of us who know people in the military, when someone in the army shoots a flare at a site and they're calling for the US, the Air Force to come bomb that area. That's literally what's happening in multiple sclerosis. These T cells have designated a friendly site as a site that's a problem, and Air Force, come bail me out, come attack this, come napalm this, and that's what happens. Your immune system sends in the reinforcements, and then we start with this nice clean myelin sheath, and you look over here at this picture on the right, and now it's all natty and chewed up, and that's because it's your immune system is called in the reinforcements and it's attacking what it thinks is a foreign invader. And unfortunately, once this process starts, until we either retrain the immune system or we replace the immune system, it will keep happening the rest of people's lives. And that's why conditions like multiple sclerosis are progressive and degenerative and don't get better on their own. That's why they start in early MS, and they go to relapsing remitting, and then they become progressive primary, and then they become progressive MS, and it just gets worse and worse and worse until we do something about it. So we know that anyone here in this conversation, in this webcast, knows that for a lot of these people, disease modifying drug therapy doesn't work. And we get to the point where your disease is still progressing and we need something else. So that's why we're talking about how well do these stem cells work for multiple sclerosis. And as I was privileged to learn over the last several months, these therapies work shockingly well. In contrast to disease modifying therapies, where a large percentage of people are progressing throughout the stages of MS. Once stem cell therapy is employed, long-term disability worsening free survival in relapsing, remitting, and even progressive MS becomes 85 to 95% at 5 years. And even 10 years out, 70% of people are in a state where their disease is no longer worsening. All this comes at an extremely acceptable safety profile, with most of the adverse events that happen as a result of us having to recondition the initial immune system and get rid of the problematic immune system. In the most recent protocols for autologous hematopoietic stem cell therapy, including the Russian protocol, which we are employing here at Adia Med, there have been no treatment-related grade 5 events in any of the recent cohorts, which we're really excited about. So, what does this look like at Adia Med? And so the purpose of these next several slides is for anyone who's thinking about HSCT for multiple sclerosis or systemic sclerosis or any of these other drugs. We want to give you a picture of what it looks like for people who come down here. And so we're going to go through a list of the most commonly asked questions and hopefully give answers to those questions. So, do we require a caregiver for people who come here? The answer is yes. We want everyone who comes to get this therapy to have a caregiver. It's a safety precaution. Someone needs to be with people all this time. We'd love to have a fully trained RN or OCN with all our patients all that time, but in the US, it's just too expensive. So we want you to be here with a caregiver, watching out with you, liaising with us, giving us feedback on how you are doing with all these treatments. How much does treatment cost? It's not cheap to wipe out a poorly programmed immune system and completely reprogram it and completely reset it to a state that's going to give someone in one of these diseases a healthy reset. So the cash pay cost is $120,000, but fortunately, most insurances are starting to cover these therapies, and AdiaMed does work with you and your insurance company to help get these treatments prior authorized and covered. Unfortunately, insurance companies don't cover lodging and travel, but it's really not that bad to come down here in Winter Park, Florida. Many people do it 3 or 4 times a year to come to Disney alone, and it's a little bit cheaper here in Winter Park than to stay down in one of the Disney resorts. But this is what it looks like, and our team is trained to help work with you to get these costs covered as much as they can by insurance. Again, does insurance cover the procedure? Yes, many private insurances do cover this procedure. That's not to say it's easy for us. Larry and his team have gone to battle with insurance companies on many occasions, taking it to the highest level of appeals, walking the insurance reviewers through why should insurance cover this procedure? It's effective, it's safe, it's actually cheaper than doing these disease modifying therapies for people for the rest of their life. And a lot of times it is necessary for us to get on the phone, to send faxes, to send appeals for weeks and months to get these treatments covered for people. But this is something that Larry has experience with, and this is something that I have experience with in doing my, cancer therapies over the years, fighting insurance companies and um, forcing them to give the people the treatments that not only they deserve, but they're contractually obligated to get from their insurance policies. Unfortunately, right now, Medicare and Medicaid and the supplement policies don't cover this. These are changes we're all working um, to change, but at the moment, no coverage for Medicare and Medicaid. So, who with MS can't get hematopoietic stem cell therapy at our clinic? It turns out most people can, in especially in the MS space. Really, our only current exclusions are people with severe pulmonary disease who can't pass a pulmonary function test, severe cardiac issues, reduced ejection fraction, New York heart failure, class 3 or 4. If your extended disability score is over 6, that's something that's been excluded from most of the clinical trials. And at Adia Med, we try and respect uh, the clinical trial protocols that have had the most success, and so that's our cutoff here. However, if for some reason your score is borderline, our trained team will review your specific set of circumstances and look at whether or not there's a reason that we can get you covered. And most of the trials have set a cutoff of over 70 years of age for this treatment. Again, these are guideline coverages. If you're on the edge, you're 70, 71, but you look like a 56-year-old, that's a different story. If you're 70 years old and you can't handle the conditioning regimen, well, we just want to make sure that our treatment is going to be ultimately helping you and not putting you at risk of further harm. So what pre-workup do we ask be done before people come get HSCTs at our clinic? Well, again, we want to see those PFTs. Those can be done locally by any pulmonologist. We want to see a cardiac exam. This includes an echo and a basic set of labs. We do want to see MRI of your brain within the last 6 months. We want to know what the status of your MS is, and and not just to make sure you're a candidate, but also so we can see, are you here and you're going to be getting better from our treatment, or whatever the benchmark is. We do ask for a standard set of CBC, CMP, other basic laboratory workup, and we want to know what your extended disability score as well. Okay, so you guys offer this for MS, but my disease isn't MS, it's something else. Am I still a candidate for HSCT? And the answer is, if you have an autoimmune disease that's been refractory to conventional therapy, there's a good chance you are still a candidate for this. And We use MS as a benchmark because MS has the most randomized phase two and phase three controlled studies, but there are emerging studies in a number of other autoimmune diseases. And there are other autoimmune diseases in which this treatment can be reimbursed and still be done off label. The bottom line is we're looking for people with autoimmune diseases that can be rectified by reconditioning the immune system and replacing it with that patient's own stem cell population. So again, initially we initially started with only wanting to do this for MS, but there are many other autoimmune conditions. If you want to know if your autoimmune condition is a candidate, call our office, have a call with Larry, have a call with me, have a call with our team. We will have an individual patient-centered discussion with you on whether or not we think this is something that can help you. Um, so going back to MS, what forms of MS do we treat? The answer is all types of MS. Relapsing, remitting, secondary progressive, primary progressive, and progressive relapsing. All of these disease phases have been targeted by stem cell therapy in various clinical trials, and all of them have had successes with stem cell therapy. So we're happy to take a call and review each person on a case basis. But we're here to deploy this therapy because we want to help people with with autoimmune diseases. We want to be there for the people that have been failed by the conventional drug therapies and what's currently out there. People often ask, what type of regimen do you use? And this is an important question for hematopoietic stem cell therapy because we do this treatment in the cancer world for conditions like leukemia and lymphoma. And the approach is fundamentally different when we do it for cancerous conditions versus when we do it for autoimmune conditions. And so we do not need to use a so-called myeloablative approach or an approach when we ablate the body's entire ability to make new blood precursors. And so when we say we're non-myeloablative, what we're really saying is we're lymphoablative. We're ablating the white blood cell population, the lymphocyte population in the body, not the population of cells that's making your red blood cells, your platelets, and so forth. And that does give our treatment approach a higher safety profile than a so-called myeloablative approach, which will have more side effects. And so you can look at an array of different protocols. Uh, at Adia, we've selected a protocol very similar to the so-called Russian protocol, which has demonstrated the highest percentage of no evidence of disease activity of 5 years. What you see here is a relatively recent protocol. There have been some additional enhancements to it, and we continue at AudiaMed to enhance our protocols to make sure that they're the most state of the art and up to date. And so we have a couple other agents and B cell modifying agents that we now use before and after this regimen. But the point is, at AudiaMed, we've selected the regimen that has the highest rate of success, and we continue to keep that regimen updated with the latest in medical evidence. So, all right. So you say, Dr. Thomas, I'm interested in your protocol. Larry, I want to come see you guys down at AudiaMed. Where am I going to stay? What am I going to do? So we are located in Winter Park, Florida, which is in the northeast side of Orlando. It's a very pleasant place in Orlando. It's named Winter Park for a reason. The suggested hotel is the Hilton Garden Inn, which is about a mile away from our clinic, but you can stay at an Airbnb nearby. There are other hotels, five-star hotels nearby if you want a little bit more enhanced experience. But we do have a standing relationship with the Hilton Garden Inn in the Winter Park, in which um, patients will get the normal rate, but we have enhanced cleaning regimens for the rooms for people who are undergoing these conditioning regimens of their immune system. Do we take patients' insurance from out of state? Yep, we sure do. We will work with any insurance company to try and get you covered. So many insurance companies do keep this covered. We just have to get a prior authorization, and our team is trained to do this, and they will work with your insurance company and they will go through the hoops and the channels that are required to try and get you prior authorization for the procedure. What about disease modifying therapies? Do they need to be stopped? For most of the stem cell protocols, yes, we do need you to stop your disease modifying therapies somewhere between 3 and 6 months before we do the stem cell conditioning protocols. As an example, Ocrevus is 6 months before, some drugs are 3 months, but we will do an extensive review of your records with your neurologist or your rheumatologist or your hematologist, and we will work with them to make sure that we're all on the same page about which drugs you can keep taking, which drugs need to be stopped, and what's most safe for each given patient in each given situation. What about follow-up? Doc, you come down and do this. What do I owe you? Well, you owe us some follow-up because we want to make sure that our patients who get this treatment have the outcomes that we're hoping they get. And so we will make sure that patients leave our clinic. You'll be on several medications that'll be up for 3 months. Some of these might be antibiotics or antifungals. And these are just to make sure that your body is safe from infection during the period in which your immune system is rebuilding itself after the stem cell infusion. We want to see or hear from you at 30 days, 90 days, 180 days, at 100 year, and we are going to keep up with you yearly for up to 5 years out of this. So this is not a treatment where you go, you get the treatment, and then we abandon you. We're with you for the long haul, and we want to make sure that you get the results that these therapies are capable of delivering to you. So what's all included in that cost you heard about? Medical care is included in that cost. Your costs of room and board are on your own, but we have negotiated, as I said, with the Hilton Garden Inn to have extra special cleaning regimens in your room, and your room will be sterilized daily during the stay. Do we have cutoffs of the EDSS? Yes. As I mentioned, based on the clinical trials, we'll take you up to a 6. And anything over that, we need to have a discussion. 7, we can talk, but more than that, it's just really difficult for people to make it through the treatment safely, and we care about safety and making sure everyone has good outcomes, very importantly at Adia Med. So, that's all I have. I intentionally left it a little short because I wanted to leave the space open for questions, for this to be a give and take between me and anyone here and Larry, and make sure that we can answer questions about anyone who's interested in this therapy, the science behind it, how we deliver it, what it might look like for them if they're thinking about coming and getting it. So, with that, thank you guys for listening to me. And I'm privileged and honored to be speaking to you.
Thank you, Dr. Thomas. That was awesome. And a great review of HSCT. I loved it. If anyone has any questions, please just hit the Q&A button and we'll get those questions answered for you. I have a couple questions though myself. You know that when you're going down, you said an echocardiogram and you mentioned an MRI within the last 6 months that you would like to see. I know a lot of people will not be able to get those through insurance before they come down to see you. And there's a lot of like, I'm from Canada. So if I said to my doctor I need an echocardiogram, he would just laugh at me because I would never get one because I don't need to have one. So would there be a chance for people to come down and pay out of pocket to have an echo down there or a more recent MRI down there before the
Yeah,
procedure?
yeah, Jen, that's a fantastic question, and thankfully, both Larry and I have cultivated a number of relationships with both imaging centers and procedural centers down here, and it's actually shockingly accessible and affordable to get cash pay MRIs and EKGs and echoes and PFTs down here. For example, I can get one of my patients an MRI brain with contrast within a week for about $400 out of
That's
pocket
awesome.
down here. And I have 3 MRI facilities that I work with, all within 5 miles of here. All the radiologists I have on my cell phone can call up on a minutes basis and get people in within a week. Um,
That's awesome.
similar with EKGs and echoes and so forth. And I know Larry, I know you've cultivated some of those relationships as well.
Great. We've got another question here. How long is the average stay in Winter Park? So how long would they be there?
So
Um,
I'll answer it. So right
yeah, take
now,
that, Larry. Go ahead.
yeah, it's scheduled for 28 days typically,
Okay.
but if they get all these tests done ahead of time, they save 3 days. So we can bring them down to 24. Now remember too, what Dr. Thomas is doing is he's doing a case by case basis for the treatments. It's not a trial. We don't have to do, for example, for um, treatments of chemotherapy. If that pay or what is required for if you're in a trial, you don't have to do four if it's not in a trial. They may be have the white blood cells down low enough in 3 treatments. Okay, so it's a case by case basis. All right. So in my case, I was in neutropenia for only 3 days. All right. So if you're out of neutropenia faster, you can go home faster. From the time we get you to 2,000 white blood cells is the half of what normal is, then we'd let you go home. Okay. So you may be here 21 days. Okay. But I don't think anything's ever been past 24, 25. Most
Yeah.
other places are 28 days.
I love the fact that you're very patient focused and patient centered. So I'm a nurse, so I very much appreciate that. And
Yeah,
I think that gives
and
people a good feeling too.
to that point, Jan, and if for some reason someone's immune system is a little bit slower at reconstituting and we see your ANC lagging a little behind, we're going to keep you here and take care of it until it's a safe level. You
Great.
get done early, awesome, but we are with you until you're a safe level.
Okay. One more question here, and I think I know the answer to this, but how many patients have you treated so far?
We haven't
Go
treated
ahead,
any
Larry.
yet. Yeah. So Dr. Thomas just gave a board a few months ago, and we just got to the agreement of what the protocols. Dr. Thomas created the protocols, very similar to Russian protocols. The oncologists we had it before that, we were having problems getting them to even talk to us, to even finish everything. So where we are right now, that's the biggest question. Can you take a patient today? The answer is yes. Okay. It will take us time to get their insurance approved. Assume if you called us today and you had United Healthcare or Aetna, those are the only ones we're covering. We're insured with, or sorry, we're providers for right now. We are working with all of them, and by December 15th, I was assured all of them will be submitted. So by sometime first month of next year, we'll be able to take all the largest one, Blue Cross Blue Shield, Humana, we already do United and Aetna. Um, so the answer is by time we are ready to have you come in, we'd be getting you approved through insurance already. So if you already have United, you already have Aetna, you can apply right now and plan on coming within 2 to 3 months. Okay.
Yeah.
All of the other ones, we're still fighting, but actually, Dr. Thomas and I are working on another angle that maybe we can do something even sooner. There's other methods of being approved by insurance to become a provider. Dr. Thomas has helped me try to find a shortcut to do it even faster than the next 2 months.
Excellent.
And yeah, and I think, I think the other point that bears mentioning is although like we are just getting Adia to the point where we're ready to start bringing in all the patients who are interested in being treated. Um, I've been taking care of patients with autoimmune conditions and with depleted immune systems for my entire career. That's what we do in cancer medicine. So my entire expertise is around taking care of patients in these clinical scenarios. So we're not new to taking care of patients in these situations. We're just new to getting people approval, insurance approval for this specific type of treatment,
Excellent.
and we're excited to do it.
So Um, for Dr. Thomas, can you share a little bit more about the IP stem cells and if they can program to heal the damage caused by MS? Let's say after you've had HSCT.
Yeah, so the IP stem cells are in a lot more of an investigative space than the AHSCTs, and I think what we really rely on in a space like MS is that the best way to get the damage healed is to remove the ongoing inflammation. So the myelin, the Schwann cells that make the myelin sheaths around nerve cells, if those cells are still alive and we can save them from the damage that's happening from the overactive immune system, they will reconstitute the myelin that's around these stem cells. Now, if the Schwann cell is so injured that it dies and it can't make the myelin sheath, that's in a situation where that nerve can no longer fully heal to what it once was. And so I think down the road, like we are looking at research protocols, not just IP stem cells, but even umbilical stem cells. What can these stem cells do to reconstitute the damaged stem cells? I think we are going to be in a place where we're going to be able to make a meaningful shift in the barometer. At Adia, we are looking at using umbilical stem cells specifically to do some of these more healing oriented approaches. But right now, the AHSCT approach is to stop the damage and get your immune system back to a reset, and then hopefully allow your body's natural healing process to take over.
Excellent. I don't see any more questions. Jen, can you think of anything that we haven't answered? I think you've answered everything
Oh,
beautifully.
average cost. There was a question in the poll about resistance to HSCT, and I think that's maybe just a broader societal question, right? But I know a lot of people, at least that I've interviewed on the podcast, their experience has been, they learn about HSCT and they go to talk to their neurologist about it, and they tell the patient, oh, it's too dangerous. You could die. This is a serious procedure. It's not for you. You're not bad. Like when I finally found HSCT, my neurologist said, well, it just depends on if you're bad enough. And that's so subjective. And it turns out I was the best candidate for it. And I still have so much old damage I'm trying to heal on this end 8 years later. I wish I would have found it sooner. And so why
I
aren't
think it,
more people promoting and supporting those of us suffering with autoimmune disease, right? To have the opportunity to stop the progression.
right. So let me answer. I'll give you my opinion, okay? Just because I had MS. So the the neurologists especially, they look at a pyramid backwards, right? They're trying to do the least drugs and then go stronger, 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 right? And then last resort is HSCT, right? That should be turned upside down. If
Yes.
you have a major attack, you should HSCT first. I wish I knew a year before, I wouldn't have dropping foot right now. If
Yeah.
I was confident and understood everything, it took me about a year and 3 months before I actually went to Mexico. If it was a year earlier, I would not have dropping foot at this
Yeah.
moment. So it needs to be turned upside down, and it will be. It's just going to take time. We need to get more and more clinics to do this treatment, more and more patients to have a success story. And here's what I really believe in why I'm doing this, right? I have a success story that I only have dropping foot. Okay. That's all that's left. So I'm going to educate you based on my story. So the best way to help somebody is be the person that can say, hey, it worked for me. Let's do it to you. Give them that moral support that this is a life changer. It's not something small. It's so much better. Like you said, my neurologist said, I'm going to die. It's a high risk. And it wasn't. He was lying. Okay. And he was pushing oak risk again. And I said, why would you push something that is toxic, that it's like giving chemo every 6 months? You're blocking my B cells for the rest of my life. That's stupid. And I'm sorry, I don't like any DMT. I don't care which one it is. I would never recommend a DMT. I recommend natural healing. Let your body heal itself. And then we can talk later about doing stem cells to do repairs afterwards. Because there is great reports or great studies showing that we can repair too.
You
We're
know,
with
and
you. That's our mission, and right? That's our mission at HSCT Warriors is just to spread the word. And
Yeah.
I don't think your neurologist is lying. I think he just didn't know. I think he's just ignorant.
yeah,
Sorry. And I mean
and
ignorant in the nicest possible way, but
and Jen, let me just kind of like accent that point you just made and kind of give people an idea of how doctors think, right? Or maybe not how I think, but how the average doctor thinks, right? The average doctor goes to the average college, then the average medical school, and they graduate average in their class, right? And they're they learn the average amount of medicine. And the average amount of medicine is, you have this disease, you do this treatment, this drug. Okay, this drug doesn't work. I maybe I know the second drug. And then if I don't know that second drug, I don't know what else to do. I got to send you another specialist. And then if there's not a specialist available, well, sorry, that's all I got to offer you. All right. But the other side of medicine is the groundbreaking side of medicine, where there are doctors doing cutting edge things like trying to build these new protocols. And it starts with a case report. It starts with one person trying something that's never been tried before. It works for that person. Then it turns into a small case series. Then it turns into a protocol. Then it turns into a clinical trial. Then it turns into a snowball that hopefully turns into an avalanche that finally crashes in to all the average doctors so they have to know about it. And so sometimes it takes patients doing their own advocacy and getting out from the constraints of the averages, finding out what's happening at the edges, and ultimately that's where we're trying to be at Adia Med. Is we're trying to be on the cutting edge, and we're trying to be there for the patients who break free of those constraints and want what's at the cutting edge and what's the best.
so do you feel we're at the snowball stage or do we have maybe a snowman's head by now? I'm thinking
Oh,
I'm thinking our snowball might be big, like a basketball size.
for
Nope.
MS, there's a small snowball starting to roll. I
Yeah.
think for the other autoimmune diseases, maybe it's a little bit less of a snowball, but they're growing. They're
Yeah.
growing.
So
I'm going to ask you this question, and I probably already know the answer, but you guys will be collecting perfect data and publishing as often as you can, and hopefully contributing to that whole body of literature that's out there. Correct?
and that's just correct. That's why we have a 5 year follow-up. We're going to follow for 5 years. You're absolutely
Perfect.
correct. So I didn't haven't told anybody yet, but we have an IRB institutional review board study
Yep.
that Dr. Thomas has just helped me submit. That's for autism. So we're going to do the same thing for MS because exactly what you just said. If we can show 50 patients first, then 100 patients, and then 1,000 patients, you're done. Medicare, Medicaid will take us then because we have a study that shows a 5 year history. So, and it's already out there, by the way. There's already besides our clinic, you got Dr. Richard Burt's not no longer doing trials. He's doing a normal clinic now. You've got UCI not doing trials anymore, doing a normal clinic, and insurance are paying it. Okay, so we're getting close. I mean, I would tell you when I went, there's no way insurance company would have covered it. That was 3.5 years ago. So now we have insurance covering it. It's
Yeah.
huge. We're getting there.
Yeah. Every little bit helps.
Jen, when you went, did your insurance cover with Dr. Burt?
No. Well, so they approved me, and a week later they changed their mind. So after
Wow.
transplant, I filed litigation and ended up successfully settling out of court to recover the cost enough to pay back everyone who loaned me the $125,000 that I came up with in cash to pay out of pocket. So I'm grateful. But yeah, at the end of the day, when you read the insurance policy, black and white, it covered any procedure that's based on an existing clinical trial.
Right. And there's many.
And
I
they're,
think I
well,
have.
the Beat MS trial is ongoing in 20 plus clinics across the United States, but using the
Yeah,
myeloablative protocol that comes with so many more complications than necessary
correct.
in order to have success with HSCT. So it was
Right.
wonderful to hear you explain that so well, Dr. Thomas, right? That we want to avoid those complications by any
Right.
means possible, including
and
using the more
and that we
effective
are having
protocol that
success.
doesn't incur those
Yeah, we
complications.
are having success without having to do such an ablative approach.
Yeah.
So yeah.
What's interesting is I don't know why they ever did the beam. Like you said, there's 20 colleges doing it. Why did they choose the beam? Why did they choose Dr. Bert's protocol? That's what
Right.
Mexico did. That's what Russia started with.
That's a
We're
very good
still
And
question.
wondering
and
that
then
question, the answer to that
well,
question.
and then if you look at the results are less than Richard Bert's. They're in the 70s. Okay, he's in the 80s. Mexico's in the 80s. Russia's in the 90s. Why would you possibly take the risk of a higher problem with that patient, other side effects, when you don't need to? There was never,
Yeah.
Richard Burt wrote
My
that years
my
ago
my
that you
guess
don't
is the
need to.
people who are writing those protocols came out of the cancer circle, right?
Mm.
Where, if you're doing these stem cell treatments to treat a leukemia or a lymphoma, you have to do a myeloablative
Yes,
approach. And if
right.
someone from neurology comes over and says, "Hey, doc, I need you to help me write, an autologous stem cell protocol," what I know is a myeloablative approach, so that's what I hand you.
Mhm.
But maybe sometimes you need a non-cancer doc to help
Yes.
add a set of eyes on for non-cancer applications.
Got a couple more questions
I
here
guess.
for us. One, is there any concerns for food safety at the hotel during your stay? So, one of the big things about nutrition that comes out of Mexico and Russia is you shouldn't really be eating out. You want to just avoid food poisoning at all costs, right? So, how will they handle that while they're
So
down there?
good question. First of all, we only did the hotel as the first option. Okay. I have two patients. Once they're coming in, we're doing the paperwork right now. They'll be going to Airbnbs and cooking their own food. And when I was in Mexico, I cooked my own food.
Yeah,
I
me
went to the
too.
store, bought everything myself, cooked it all myself. Well, my wife cooked. I shouldn't say I cooked it myself. My wife and my nurse cooked it for me. I'm not a good cook. Anyway, so same thing. You go to Airbnb and cook your own food. All right. And that's your option. And it's not much difference in price in an Airbnb than it is at a hotel. So that is if I had the option, I'd go to Airbnb. Okay. If you are going to be in a hotel, we suggest you only do name high-end restaurants, name brand restaurants. And in that area, you can walk to five from your hotel within less than a block, right? And Dr. Thomas is probably I would say at least five, right? Within that walking distance right there. And then you've got Park Avenue, which is a beautiful restaurants. Hannibal Square. There's so many really high-end restaurants. I wouldn't worry about
Yeah.
When I was
problem.
in Chicago inpatient, my husband would take a walk just to get some fresh air, but he would go to the Trader Joe's and buy some fresh avocados and bananas because my potassium was low. And being self-pay, I wanted to minimize costs. And if I wanted to cut out that potassium supplement, I thought, well, I'll just start eating bananas and avocados. Sure enough, my potassium levels came up and they were raw, fresh foods, right? From the grocery store around the corner. He would
Yep,
bring me sweet potatoes from the barbecue restaurant around the corner that were amazingly delicious.
yep.
I mean, I'm
And
not saying like go out and eat raw food, but if you're safe and clean your vegetables and
yep.
prepare your food well and don't eat anything raw sushi,
You're
then
right.
Well,
Yeah.
and so Trader Joe's is literally less than a mile away from this hotel and from some of the Airbnbs.
Beautiful. Beautiful.
Yeah, so, yeah,
And
we're
there
we're
is another
actually
hotel for those of you who might, if you want to be, stepping it up a notch. There's a hotel called the Alfond Inn, which is also similarly close by, which is a five-star little boutique resort hotel that has phenomenal high-end healthy cooked food a mile and a half from here. So
Well,
also
I'm
an
gonna give you
option.
one last thing. I have a meeting next week. I am looking at doing different houses where you can do a house Airbnb. I have a call with two different people that they don't want to do Airbnbs the way they were doing them, like a day or a weekend. They would like to do the month rental of it. So then I really like the idea of being able to cook your own food. Like you just said, you get your organic foods, you cook them there, you know what you're eating. Yeah, I believe the reason, so my stem cells went into my blood from my bone marrow within 3 days. Everybody else was 5 to 7. My when I was into neutropenia, I was out of neutropenia within 3 days. I believe I worked out 7 months before I went to Mexico and ate organic all that 7 months, and the entire time I was there, I ate organic only. Okay, so I would recommend anybody that's going to come get this treatment work out at least 3 days a week, as much as you can. And we can talk about ways to work out that I know some people can't do as much, but there's things you can do that just move, get your body active.
Yeah.
And then or as organic as you can afford, because it is expensive, but you can get a lot of things organic that aren't that expensive.
Good.
Any other questions that you see in the chat?
No, no, I think we've covered a lot, so it's been
We
great.
have. Super
Dr.
informative.
Thomas, this was, I got to tell you, I've been dealing with MS patients like probably 2 to 3 a week. You answered every question they always ask me, everything. I don't think you missed anything.
Perfect. So
Amazing.
you can always, direct them to our website. We'll get that link put on your
That's what I
page
do.
maybe, and you can
Yep,
send them to this and they can watch this this will answer so many questions for them. I think
yep.
it's fabulous.
I
Thank
agree.
you. Thank you
Absolutely.
so
All
much.
right. Well, to everyone
Mhm.
listening, we wish you luck and Godspeed on your journey, and we're here if we can help you.
We appreciate you both, Dr. Thomas and Larry, for being here tonight and sharing so much more about all that Adia Med has to offer. We look forward to connecting more people with you in the days and months to come.
Absolutely.
Take care, guys.
All right.
Bye bye.
Thank you guys for having
All the
us. Take
best to
care.
you on health and wellness. Take good care, everyone.